Hi, Paul Griffin here, MARTA's Director of Infectious Diseases, with another update on COVID-19. The situation certainly has changed since my last update, with a cluster in the Greater Brisbane area that's still under investigation. We've seen a large list of locations published where people that were infected have travelled, and I'd certainly encourage people to keep an eye on that list and have a very low threshold for getting tested if you develop any symptoms. It's also important people pay attention to the public health warnings that are being issued so that we make sure this cluster is minimised and we get on top of it as quickly as possible. In an effort to do that, we've seen a big change in the recommendation for masks in this last week. Masks are now recommended for use with any patient contact or any person visiting in any hospital, and also in the community if people can't maintain social distancing. While we're using masks more broadly, it's important to understand that this is a useful addition to the other interventions we're recommending and does not replace social distancing and hand hygiene, as well as the recommendation to get tested and stay home until you get your result if you have any symptoms. Another change we've seen this week recommended by Queensland Health is to change how visitors can attend our hospitals. This is likely to continue to change into the future, so if you are wanting to visit any hospital to visit a loved one, then make sure you pay attention to the recommendations at the time. Despite the recent cluster and all the changes we've seen, we continue to have good control here in Queensland, and so far the impact of this cluster has been fairly minimal. But to keep it that way, we need everybody to keep doing the right thing. Pay close attention to the recommendations from Public Health, keep up your hand hygiene, social distancing, and now use a mask where it's recommended, and above all, make sure that you get tested and stay home until you get that result if you have any symptoms.